Hello, everyone, and welcome to day one of Patient Congress. My name is Nicole Braccio. I am the Policy Director at National Patient Advocate Foundation, and I am so thrilled to be here with you all today. We will go through a few housekeeping items before getting started. But first, I wanted to thank all the participants for joining today, as well as our sponsors for making today's event possible. So thank you all. And we have a lovely agenda for you today, along with 2 more days following today. So just for some housekeeping items, we hope that you will stay engaged with us throughout the presentations. So if you have any questions, please enter your questions in the Q&A box at the bottom of your control panel. And note that closed captions are available for today's session. So please use the control panel to access that as well. And if you need help with that, or if you are experiencing any sort of technical difficulties, please do not hesitate to ask. It happens to the best of us. You can email us at npafevents@npaf.org, and someone will get back to you as soon as possible. And also, if we would love to know where you're joining us from today. Patient Congress has always been a very community-focused event with our volunteers at the heart. So we're excited this year, as well as last year, to invite additional partners to join our community. So please let us know. You can change your name in the Zoom. You can right-click on your name or the box where your face shows up, or at the 3 dots at the top right corner, and then select rename and give us your name and your state that you're coming from, or an organization if that's who you're representing today. And without further ado, the agenda will just give you a sneak peek of what that looks like. Today, we will have 3 sessions that you can choose to join. The first is our main stage session, where we will have our first panel on needs navigation. Then after that, you have the option to join one of 2 sessions. And then finally, after that, you can see here on the agenda on the slide, there will be our final session that we'll all come back together for. So we should be ending the day around 3:15, 3:30. And without further ado, I'm thrilled to announce and introduce our Chief Executive Officer of both Patient Advocate Foundation and the advocacy affiliate, National Patient Advocate Foundation, to kick us off for the rest of the day.
Wonderful.
Take it away, Alan.
Thank you, Nicole. Welcome, everybody, to Patient Congress, hosted by the Patient Advocate Foundation in collaboration with the National Patient Advocate Foundation. You're probably all tired of hearing this, but very sorry we can't all be together in person, but glad you could join us from wherever you are virtually. I'm in my kitchen in Yorktown, Virginia. So thank you again for spending the next few days with us. We're going to be talking a lot about social needs navigation, amongst other topics, throughout the next 3 days. At Patient Advocate Foundation, as many of you know, this is a service we've been providing since we began 25 years ago. It is the core of our organization, who we are, what we do, and how we learn from the patients we serve, particularly the most vulnerable patients suffering from all types of inequities in the healthcare system. So the one thing that you all probably should know the most is we call it case management. There's a lot of terms you could use to describe the service, but externally we're referring to it as social needs navigation. And one of the ways that we are trying to make sure that we establish the best standards and the best approach and the best way to scale social needs navigation is to really understand the science of it, what it means for patients, how to do it. We'll be talking a little bit about that throughout the next few days as well. But one thing I'm excited to unveil to you, and it's the latest and greatest thing from the Patient Advocate Foundation, is what we're calling the Patient Insights Institute. So you're privileged to be here at the beginning. We're launching this today. This is the official unveiling. And I'm going to turn it over to Dr. Rebecca Angove, who's our Vice President of Patient Experience and Program Evaluation, also the director of the Institute, which we just unveiled 30 seconds ago. And she's going to talk to you a little bit more about it. Thank you, Rebecca.
Thank you so much, Alan. Yes, this audience is the first to know about our Patient Insight Institute. We are launching officially today. We have just a few slides to introduce this newest initiative that PAF is working on. And we are going to touch on it a little bit more throughout the entire Patient Congress. But if we could just go to the next slide, I will get started here. So really the focus of this institute is to ensure that healthcare is informed by the whole patient, and specifically the diversity of patient experiences and voices that really have historically been underrepresented. We are going to empower and work closely with people and partners that want to improve access and affordability and really see the patient perspective as critical to informing change. This institute really builds on what PAF has been doing for 25 years, both the service, the experience, the data, the policy, the advocacy work. This institute is really a connector to help connect research, healthcare, and policy leaders to our population and the experiences of the patients that we serve and work with every day, specifically with access and affordability issues. And as you'll see through a few of the sessions over the next couple days, patient centricity is really becoming a critical component of not just care, but research and policy. And we're really supporting that and making sure that every voice from every different perspective is represented in those spaces. We're going to do this in a few ways. We're going to identify and prioritize patient and caregivers' needs and outcomes. And again, PAF and MPAF has been doing this for years. This is just a formal home and space for us to do this, both with our patient and caregiver partners, as well as our number of other stakeholder partners. We're really going to move and advance that next generation of patient-centered and caregiver-engaged health services research. So we're going to really make sure that not only is policy patient-informed and care is patient-informed, but research is as well. And we're also going to take everything that we learn every day and generate real solid evidence to help support policy and advocacy initiatives so we can drive change with evidence. So a few things to just be on the lookout for. We are working on the website. We are working on some resources. We're going to have project and partnership announcements, and we're also going to have opportunities for you to get involved in our great institute. So more to come. Thanks for the opportunity to let me share this exciting initiative with you, and I hope to see you all at some of our in some of our projects and involved in some of our initiatives.